Welcome to this JAMDA author video presentation. I am Diana Feldstein, the primary author of a systematic review examining nursing home antibiotic stewardship programs, which is published in the February issue of JAMDA, the Journal of the Society for Post-Acute and Long-Term Care Medicine. This is an infographic from the Centers for Disease Control and Prevention describing the current situation of antibiotic prescribing in the nursing home. Let's go through it. Annually, 4.1 million Americans are admitted to nursing homes. As many as 70% of these 4 million people receive antibiotics in the nursing home setting, and as many as 75% of these prescriptions may be inappropriate. It is not surprising that calls for more appropriate prescribing have come from the Infectious Diseases Society of America, the CDC, and the Centers for Medicare and Medicaid Services. The IDSA defines antibiotic stewardship programs as coordinated interventions promoting the appropriate use of antibiotics to improve patient outcomes and reduce microbial resistance. These programs are currently mandated by CMS in the American nursing home. There is little literature to determine which parts of these programs, if any, change health outcomes for nursing home residents. We asked if antibiotic stewardship programs change health outcomes in the nursing home. This systematic review examined the extant literature available in PubMed, CINAAL, Embase, and the Cochrane Library published through February 2017. We reviewed over 800 entries pertaining to antibiotic stewardship programs in the nursing home, and we ultimately included 14 papers of good or fair quality. Each study defined the intervention audience differently. Some included prescribers exclusively, and others were more inclusive and considered residents and their families. We found no evidence that antibiotic stewardship programs change final health outcomes in the nursing home. Of the papers that measured mortality, no change was detected with the measured intervention. There was also no change in the incidence of C. difficile infections with the measured intervention. At the same time, there were no negative health outcomes. The interventions changed important processes of care, including improved adherence to recommended treatment guidelines and reduced numbers of antibiotic prescriptions, again without changing mortality. In conclusion, this review found antibiotic stewardship programs are effective in changing antibiotic prescribing with interventions that involve different members of the nursing home care team. Strategies that worked included nursing team education and training, educating and providing guidelines to antibiotic prescribers, and incorporating residents and their families into the educational process. This is particularly relevant as prescribers often cite pressures from residents and families for potentially inappropriate prescriptions. Finally, we note that based on our review, antibiotic stewardship programs do not appear to increase mortality, an impressive accomplishment in this high-risk population. Thank you for listening. For further details, please refer to our review, which is available in the February 2018 issue of JAMDA, the Journal of Post-Acute and Long-Term Care Medicine, which is available at jamda.com.